So yeah, it's actually 24,500 upfront savings if we actually switch to this program, and from my understanding, completely offload the payroll process.
Paul and I had a brief discussion today over Teams about the calculations, and we're still keeping that on our radar that nationwide may not be our avenue to get this corrected. So we're keeping an eye on it, get it resolved. All right, the big one, had a big packet today. HR payroll software. It's been a discussion for a long time between Paul, Kathy and I about making some changes. I know Paul, since he's come on board, has a plan. He would like to outsource payroll and Emma's currently doing that right now. So we have two systems right now. We have ADP and UKG. From my understanding, I work with Paul. They're pretty expensive. So we did some demos and I solved, for example, Crook County stuff. And it's pretty easy software to use. And Paul, if you remember the numbers, please jump in. I don't have them. But
sure. Yeah. Sorry.
Thanks,
real quick, it was $18,400 for the $18,400 for the year, and then $24,500 for the second year, and that was negating the startup cost that we had discussed that you actually negotiated away today. So congratulations on that. So yeah, it's actually 24,500 upfront savings if we actually switch to this program, and from my understanding, completely offload the payroll process.
Yeah, and what Paul's referring to, they kept following up. Obviously, they're very good salespeople. They want the business. They said that they would hold off the implementation costs. We went live.
So one quick question. Sorry, this whole thing. So is it going to be another deal like Sage was, and just a horrible switch, impossible switch, or does anybody have any opinions on that?
I guess what happened with Sage, because I don't know
either. What was Sage even? Payroll?
Well, I don't know if it's payroll.
Yeah,
it's just another computer program.
Switch.
Yeah, it's not payroll.
Maybe 3 years. Yeah, and there was growing pains. Yeah,
I think with any implementation, in my experience, there's always growing pains. And I know Wendy was very helpful with that during her time here. So this isn't reference to her. I speak from the HR side of it. I think that I can only speak for myself and my experience, and I feel more confident about making sure that it is correct and compliant versus what I've probably seen happening before me. But no implementation is without growing pains, especially when you're dealing with big companies like ADP and UKG. They are slow. So for example, if we were actually going to ADP, first of all, they want $140,000 just to upgrade our system, to do the timekeeping and to actually process payroll. Yeah. And the price that you see in there is actually much less. So, yeah, the implementation is always going to be a mess. I think it's your team. It is your team. We've got a great team here of people that know what they're doing and coming together. And we would be on those calls, right? We would be on those meetings and making sure everything is built the way that it should be.
it was Wendy on. Was Wendy on that?
I don't have an opinion. I've not seen it.
Okay.
I
was not part of the demos.
HR did the demos. I had Kim and Emma did the demos, and then Kim did because PBJ reporting is important to her. And so she has to have it. So they do supply that. They run Crook County, so they have the same equipment.
Peanut butter and jelly.
Yeah.
Payroll based version.
Yeah.
Rebecca, do we have any estimate, or maybe Paul, on how much man hours we're using right now to complete a payroll cycle? How many hours is somebody putting into that to do payroll?
Yeah, I would defer to Emma, because Emma's the one doing payroll, but I would say it takes at least 4 days. What do you think?
Yeah, I'd say that's about right, yeah,
Every 2 weeks.
every 2 weeks. Yeah.
Plus all the
So that's a
managers
week
that
time.
clean up the time cards and.
Yes. Can we bring this to the next board meeting?
Yeah.
And I just haven't had a chance to really sit down with the team and tease it out.
I don't know why you haven't had time.
Yeah, that's all right. I trust their numbers and what have you. So we have a special on Tuesday, but that's for a special. So the next board meeting would be within a month.
It would be April.
Is that gonna hurt with our
April
negotiations?
23rd.
I think they want the business so bad they'll extend the quote.
Okay. So I think let's loop in the senior team, and one of the things that I've learned when we outsource payroll at another place is there still needs to be a point person on site to nudge. So you'll be lessened hours from this nightmare, but at the same time,
Wendy needs to
yeah,
be looped in.
Wendy needs to be looped in and the other team, because the managers, if you're doing a lot of the payroll work now, we really need to make sure the employees are taking care of their own time cards. So I want to talk about that training and how the employees need to own it, the managers need to own it. And then there still will be that conduit piece, but I'm supportive of the concept. I just want you to know. But it'd be good, just give me a little time to circle the wagons.
And I would just ask that we could include some kind of cost benefit
Yes,
analysis. of that.
yeah, absolutely. We'll have slides.
Wonderful. Slides are better.
One of the questions that I will ask in a month
Yes, you
Is
give me the best beforehand.
is going to be how much of a contract do we have with ADP and this other, are we going to overlap because
fair
of
point.
timeframes?
Yep.
Or would it be better off waiting 3 months that this contract is lapsed,
We'll find out
Or-
determination.
but not to make the employees pay lapse?
Right,
Yeah.
That's important.
That's really important, stop one system, start another one, nobody gets paycheck.
Right.
Yeah, and do we run parallel
Yes.
paycheck payments too?
Well, it's super awesome that you guys are looking into that and that you
Yes,
gave us that much money. That's great.
Well, no, and I compliment that. I respect that, and at least we got the conversation started.
Good.
And I won't beat a dead horse, as my grandma would say, but one of the benefits that I think is that I do have that vacant spot in my office. I've been really hesitant to fill it because it does take time that we don't have to train someone. And then when budget concerns, I'm trying to be mindful of that. But that said, this concludes leave management. So that right now I'm currently handling all the leaves on my own, and that's taking up an extremely high amount of my time to do things I should be doing. So that is included. So that's what I like that.
Plus it gives us redundancy. If Emma were to win the lottery and say, I don't want to work here anymore, we'd be scrambling to find another replacement person. This way they have next person up, next person up, next person up. And then we also then still have our point person on site who helps us.
Very good. So you'll, perfect.
So we'll put it on the agenda for the next.
My own list. Yes, I'm done.
Okay, very good.
Thank you.
Anything else that we need for Rebecca? So, very good. Thank you for that. Okay, so now we'll jump back to the number.
So census today is 5 patients, 1 inpatient, 2 skilled twin bed, and 2 intermediate sick beds. Total admissions for February were 28, 17 acute care, 8 skilled twin bed, and 4 intermediate swing beds. Observation admissions were 6, and emergency room patients totaled 162. Number of referrals I receive remains pretty steady at 1 to 3 per week from Rapid City and Gillette, except for this past week. It just seems like patients are going to Vibra in Rapid City. Legacy opened again for skilled care, so I think maybe I'm losing some of them to them. So that has started a campaign. Charlotte and I are gonna get together and, build a brochure that we can give to potential patients that, you know, even the ones that are in the emergency room, that we can entice them to come back to our program. You know, a picture of our beautiful rooms, the staffing we have, and the services that we can provide them. So hopefully, hopefully we can bring in some more patients and get our census up. It just doesn't seem like we've had the type of patients in our emergency room even to admit here or transfer. You know, not a bunch of hip fractures. You know, we've had some surgical patients, things like that. But you know, typically we have somebody come in with a respiratory issue that we need to keep for 3 days, and then we skill them for therapy for however long. So hopefully, you know, in the next month or so, that'll improve.
The truth is, those rooms are a positive. They're
Mhm.
amazing rooms.
Yeah, we're pretty lucky for the facility. Our census has remained stable at an average of 4 to 6, and we've had no low census staff days. Cardiac rehab has really picked up. There were 7 in February, but the girls now have 11 cardiac rehab patients that they're scheduling. So that's really good. That's the most I think I've seen. So good for them. My nurse, Michelle Heed, had her last shift the 21st. She's staying on PRN, but she went to the courthouse. I'm currently looking to hire a full-time RN to replace her. But with summer coming, I may need to bring in a travel RN just to cover those summer vacations. So far, my staff has, they do self-scheduling, and they've been able to cover the schedule with just a little bit of overtime to just get those shifts covered. So they're working on the next schedule, and we're going to see how they do. And if they get them covered, then we will need a traveler. I'm looking to hire 2 full-time CNAs, one to replace a travel staff member and one to work once the summer's over and my college staff go back to school. We did have a CNA student that did her clinicals yesterday and today, and she'll again be here on Friday. And I told her if she continues to be interested, we could do a small interview and see if we can't bring her on to cover that travel spot. So I'm glad for that. And I also would like a PRN RN that could help my cardiac rehab nurses, and just so more sessions can be done with those patients, get them done quicker. You know, they can come 3 times a week instead of 1 or 2. So that would be helpful. And then they could cover some of those overtime shifts as well. There's a report in EPIC. It's called the ED facility level scores, and it's based upon the procedures done by the RN staff. And the more procedures they get done, the more points they get, and the more we can bill for. So there's a whole list. I was going to bring it, but I don't think it's necessary. But anyway, the nurses are really working at getting those procedures done so that the point scores go up, and we're doing pretty well. As I mentioned, the emergency preparedness trauma coordinator, Tammy Dowding, is out on medical leave. So I've been trying to cover her duties. I have her email, and with Chelsea Dannins, we can do some of the trauma coordinator duties to keep in compliance with that. And then the EMTALA review we had on February 18th and 19th, we still haven't heard back from them, but they did tell us it would be a few months before we would hear that. And then my QI project is still the discharge vital time on the ERs and inpatients.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
Any questions for Mona?
Madam Chair, if I might just make a comment. I, when Pat had her meeting with you guys, she said we might have, financial issues or things, but the biggest thing that we should always concentrate on is the patients. And while it was not my choice to be a patient here, I ended up in the emergency room at 3 o'clock in the morning, and then I ended up staying overnight. And I have to say that the care here was truly phenomenal. From the minute I was dragged in the door by my husband, the care was just phenomenal. And I was not the easiest patient because I was pretty miserable. But everything, the whole team came together, and it was really a wonderful thing to see from how well the nurses work together as a team with the clinicians. And it's this wonderful girl from the lab came in, and
Wasn't she the nicest thing?
she was just the nicest thing. And just the way that the whole team worked together was really a wonderful thing to see personally. So that is one thing that I would just really like the community to know, that while we might be having some problems with our financial reports, we're going to get that under control. But the bottom line is our patients come first, and we do a phenomenal job taking care of our patients. And I want to thank you all for that, because you're all part of that team. So thank you.
Anything else for Mona? Good. So we are, Paul, you're up next.
Yes. How's everybody doing? So I know it's very tense right now, but the good news is that the FY24 audit has been handed in to DZA. The final commentary that we had to provide as a management team to DZA has been sent over in the form of a draft. So far, there has been no comments on the draft we sent over. As it sits right now, we expect to submit our FY24 audit to the state on 3/31. I think that's next Tuesday. And essentially, once we submit it to the state, we'll also submit what's called a plan of correction alongside it. And that enumerates all the things that we're currently doing in the finance department in terms of controls, processes, getting the right type of documentation, support for transactions, things of that nature. So all that will be buttoned up on 3/31. After that, actually, let me back up. So on 3/31, I think, Carrie, you might have mentioned it already, but there should be a special board meeting on 3/31 to discuss the audit prior to submission, if that's okay. And we can move that left or right. Actually, not really right, but we can move it earlier if we have to. Just let us know. Once that happens, the FY24 audit is submitted. We're good on that one. What we must do next is get DZA, who's our auditors, to send a letter to the State Department of Audit regarding the FY25 audit timeline to submission. And just so we can level set for everyone in the room, we have, meaning Weston County and my team, have until April 16th, essentially, to hand in all the documents that they may need to run the audit. And their target date, DZA's target date, is July 1st. Go ahead.
Hey, Paul, can you turn up your volume? Possibly turn up your volume on your end?
Or talk
My volume. Yeah, my volume's all the way up. I can talk louder, but maybe turn up your
Okay,
volume.
we'll take that.
Yeah, trying to turn the volume up here, and we aren't having any luck, so talk louder.
Okay. Well, so yeah, that's essentially where we sit. Audit is going to be on target submission date for July 1st through DZA. We have until April 16th to hand in all the FY25 data and make all the corrections that resulted from our FY24 audit information. And then once that's done, it goes to DZA. DZA does its thing and submits on July 1. So that's the audit piece. Are there any questions on that?
So I just want to help tie what you said as far as the 2024 audit, hence the special meeting
331.
on 3/31. We're going to have audit presentation by DZA to the board, so you can accept, vote on receiving, and then we can get that out to the state auditor's office.
So then just, I'm not sure if Paul will tell you about the rest of the timeline, but once that is submitted, then Paul and his team will scramble for 1 to 2 weeks on all of the 2025 stuff, and then that will be submitted to the auditors, and they will go back and forth for about 2 months. 8 to 10 weeks, right, is the DZA's timeline, and that's why we're shooting for July 1st, and then we'll be fully in compliance with all of everything that's been outstanding. So, as you know, that is a huge amount of work, and we're very close to being fully in compliance.
We are. Very much so.
So, yeah. Oh, well, on that 2025, this is just a question. So how much those, like, you'll have to have supporting documents and things like that. Do you get those? This is kind of a dumb question maybe, but maybe everybody knows it except for me. Do you get all those supporting documents? Do they come basically from the managers? Is that where you get supporting documents for the 2025?
Billing office. Sure. Yeah, the billing office, the managers, whoever has the invoice, for example, we would get it from them. The biggest challenge in the FY24 audit was the mid-year change of systems from I think it was Meditech over to what we use today. And so in that transition, there was a ton of data, and I'm not trying to talk down about anyone or anything like that. It's just what happened. There was a ton of data that was lost. And so there were resulting holes in the FY24 financials that we couldn't kind of substantiate through invoices and things like that. So the goal is for FY25 to have what they call a clean audit, no opinion or unopinionated audit, and had all the supporting documents and everything that we might need. I connected with them earlier today to talk about this briefly, and we feel pretty confident that we should have much, if not all, of everything for FY25 somewhere in the business office and surrounding areas. So feeling really good about it. It is a lift, I think, like Carrie said, but we're up for the task and we're going to bring it home.
Anyway, sorry for the interruption. Continue on. Oh, go ahead. Ben has a question.
Well, just for the public's information, can you give just a little bit of information why these audits were, you did a little bit just a minute ago, but a little bit more of why these things are so difficult and why it's so hard for us to, and if there's really no other way it could be done. Can you explain that a little bit?
Absolutely. So an audit is really difficult because they're trying to peek into the financial interactions and systems within Weston County or whatever business they're auditing, right? And so to do that, they have to have a bunch of not only surface level information, but of course supporting documentation, accruals that are documented and kind of white papered, as we call it in our space. All these assumptions and estimates and bills that would come across, they need hard paper to then substantiate whatever they're seeing on the screen in an Excel spreadsheet. And so part of the whole process is not only getting that Excel spreadsheet across, but a lot of what supports that Excel spreadsheet on the back end as well. They come to us later on down the line after we submitted everything and start these volleys of information requests. And so what we do then is support those information requests, gather the information in detail, send it across, and then have those conversations with them about whatever it is they're looking at. So it's a very complex process.
Basically, you started from scratch when you got here, correct? With very little.
We started so far behind the eight ball. It was a monumental task. I'm really proud of my team for getting it done. They were the ones lifting the heavy loads. Quite honestly, it was I came in here thinking that it was some backwards journal entries, stuff like that, but it turned out to be a reconstruction of your entire financial statements for the past 24 months. And we're not even 100% complete yet. We're still on that pathway. Just it's a very large volume of work that had to be done in a very, very short period of time and had to be right. So the whole adage of you want it, quick and fast or cheap and all of that, you have to pick two. So it was very difficult to get it done in this short period of time, but we did for the FY24. For FY25, it's the same game. We just have to get them all the information they need. We're very confident we can do that.
Thanks, Paul.
Yes, sir. Okay. So if there's no other questions, we'll just hop right into the financials. Just give me 1 second to change my screen here.
Paul, can you share your screen? I was going to try to share it, but.
Absolutely. Absolutely can share my screen. And let me know if you all see that pop up there.
Yes. You'll need to
there,
make
but
it
it's
bigger.
really small.
Here we go. Well, everyone should have packets. Am I wrong on that?
It's their full screen mode.
It's so thankful.
Say it again.
It's a double click to enter full screen.
I know that.
Yeah, there you go.
This is okay.
You can pop it up on.
Yeah. Yep.
Read those numbers. You're better.
Can you hit the plus sign?
Dave can read that.
Right there,
I don't know, but you are.
it says contract.
Okay,
We good?
finance people.
We're good to do this.
Hey, don't blame the profession. Okay. So for February of FY26, net patient service revenue declined approximately by 1% month over month, which is kind of relatively modest. But by comparison and compared to the budget, we hit a 16% decline, suggesting the organization performed materially better than the budgeted area. However, the problem is with this budget, we're hitting these kind of weird variances, not just in revenue, but kind of across expenses and all that. So anything with a variance to the budget, just holding a caveat for now, and we can explore more about that later. The one thing I do want to point out for the team really quick is that in January, under variance at the top where it says total patient revenue, that 2% should be 15%. That was a typo. Just want to point that out really quick. Okay, so moving on. Total revenue deductions were slightly elevated for this month, but generally still in line with the year-to-year trend. Importantly, deductions came in roughly 20% below budget, which is favorable when you think about deductions. Other operating revenue was down approximately 63% month over month, but the decline is primarily attributed to the fact that in January we had a one month, one-time Medicare gap payment for $703K. So that's why you're going to see that million and change right there. If we strip out that $703K gap payment, we'd look at other operating revenue of roughly $389K. So which is kind of in line with what you're seeing in February and also December. So I'll pause right there really quick as we walk through. Does that all make sense so far? Do we have any questions on any of those line items? No? Okay. And stop me if you have any questions. I'm happy to answer anything as we talk. For operating expenses, this increased approximately 15% month over month, or about $320K. This is normal to a certain extent. We have about $100,000 of leftover burn after we pay AP each month. So that means that in essence, we accrue $100,000 more per month in AP.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
Since we accrue $100,000 more per month in AP. So if you think about it like that, you understand that you have that 100K, and then we had some renewals in this period as well, that would all have hit your income statement here because they're incurred during that period.
Okay, wait.
Yeah.
Somebody has to put that in real words to me.
So we practice what's called accrual accounting. So we don't time expenses or revenues when we pay them or when we receive the money. We time them in the period in which they incur or which they're incurred.
It still doesn't help me.
So if we get a bill, let's say $10,000 for something, and we're not gonna pay it right away, because you have your 30 to 60 days, we're still going to plan for the expense, accrue it when we close the books because it was incurred in that month and we had it. So that we try to even out our expenses as they come in, our recording of the expenses as they come in to tie with the revenue. So you don't have these big bulks like this. So you accrue, you say, I'm recognizing that expense of $10,000 in the month that it was incurred, but even though I may not pay it in that month, it evens out the books.
So I understand the accrual piece,
But
but what I don't understand is what he was telling us.
Oh.
Like,
So he
That's
was
what he was
saying
saying.
that he accrued more expenses than he actually paid.
Oh, okay.
So,
Yeah.
but that's the best.
Paul, am I right?
Pardon?
But
Yeah, I think you're right. I can hear you sporadically, but I think you're right. Accrued more than actually paid is kind of the point. Yeah, it's the challenge is we're accruing more than we're actually paying each month.
That's what I was trying to
But then it catches up.
So he piled them all in the back, but didn't write them out of the check. Yeah.
And that's a great question, right? So does that kind of fully explain that area? Okay. All right. So the increase was largely driven by the repayment of the aged accounts receivable and the recognition of other historical liabilities that had not previously been fully captured within that enterprise accounting system. So if you remember, probably, I want to say January and February's meeting, we talked about, hey, there's a stack of invoices that have not made it into the AP system yet. This is the result of that. And so we actually had, if you look at the financials, that $320K increase in that whole operating expense area. That's kind of where that all came from, right? It's over and above and beyond like what we typically would spend in that month. And that's kind of where we're getting it from. We had a heavy AP cycle at the end of the month and at the beginning of the month as well. So it was kind of coming from both ends, but we had to play catch up. Not gonna lie, we're still digging out of the hole for a lot of these vendors. Pat and I are working on a plan to address it kind of on a broader scale. It's all 1,500 and some odd vendors we have, 1,563 vendors I believe we have. And so the whole challenge is to let them know, hey, look, we're gonna make it right. Give us a bit of time, be patient with us, and we'll pay you your money for sure.
Paul?
Yes.
Just a quick comment, I guess, or maybe question. Some of this relates to what you're talking about, the problem with the targeted budget too, correct? Because you don't have any historical numbers that really can back and show you what would have been a normal month year previous, correct?
We had
blind.
Oh, sorry. Sorry, go ahead, sir.
Yeah, you're kind of flying blind is my point.
To some extent, right? To some extent, what's really killing us is the lack of visibility into upcoming contract renewals. and the lack of the AP actually being in the system from historical AP incidents. We've since corrected to a certain sorry, sir?
I was just gonna say, because we knew last budget year that we were basing budget on bad numbers. We knew
So-
it. We had to
so-
go forward.
Yeah. Understood on that. On the budget side, the budget was created based off of the financials that haven't been corrected that we had no part in. That's the flying blind piece that I would attribute the variance that you see on every one of these financial statements. That's what I would attribute that to. We have since gone back to correct the financials of previous periods to have accurate trial balances. That's how we were able to get FY24 audit and FY25 audit in.
All right. Thanks.
Yes, sir. So on an operating basis, the organization posted approximately 518K loss for the month. It's important to understand, though, that this is heavily influenced by the effort to catch up on our AP payments, and also the offsetting amount that we received in January, that 703K wasn't here in February, obviously. So it makes the percentages look kind of awkward. But if you strip out and you go from an adjusted basis, it looks very similar month over month. The shortfall that we're really looking at really is attributed to that additional AP and a few other operating items. So if there's no questions, I'll start talking about OCI.
Looks like we're good.
Okay. So for
We have
OCI,
No, I was just gonna say, so why we have this, I'll let Paul talk. I look at both month to date, but I also look at year to date. And so we have this bit of an anomaly in the month, but on the year to date basis for the operating, we're near break even, but we're not there yet. So keep going, Paul.
Okay. Yeah, and historically, as of January when these were rolled, we were positive 418,000, I believe it was, or something like that. So we're on that precipice of that break even, and really, if you think about where we should be year to date projected for the budget, I'd say we're doing pretty good. So that's how we know that the budget is not really usable in its current form, and the variances and all that. We're talking 3.3 million versus a negative 103,000. Orders of magnitude off. Okay, so below the operating line, which is down here in other comprehensive income, a nominal amount of income was recorded from dietary due to staff and visitor meals and snacks. Interest income in the form of CDs and Harry Ackley Memorial Fund contributed approximately $6,000 to the positive margin, while approximately $5,800 worth of interest, which is right here, $5,800 worth of interest detracted from that margin. So the net of those two obviously is going to get you to your total non-operating revenue line item, which is second from the bottom, the 1348. And so adding the operating profit or loss to the non-operating revenue or loss will get you to your total net income of 517,403. Again, really driven by the additional AP we expended this month, and a few other small operational items, but nothing as material as the AP items, I would say. Anyone have any questions before I hit the balance sheet and cash flow statement? Good. Okay. All right. So for February, cash materially declined around 659K. This is driven again by that heavy AP cycle and delayed cash inflows. We did have that missing revenue from the manor in January, and I know we're getting it caught up right now in billing, so I appreciate that. But that also contributed to the lack of cash available for operations. Revenue converted poorly to cash, showing roughly 495K increase in accounts receivable. We generated revenue, but too much of it remained uncollected at the end of the month. And current liabilities increased about $311K, reflecting those continued pressures from the unpaid obligations and historical AP that had not previously been fully captured into Sage, unfortunately. Operations used cash during the month with about $671K of cash consumed by operating activities. And reinforcing that this is primarily a working capital and cash conversion timing issue. And so when I dug into it, what it is that if you look at our day sales outstanding, we just have an incredibly long DSO. And I know there's been discussion about, is it self-pay? Is it commercial payers? What is it? It's really arguably across the board. However, when we think about concentration of risk or orders of magnitude, it does revolve around that self-pay and Medicaid, actually. So we're looking into that as well on the finance side of the house as we think about ways to increase that cash collection engine. The key financial priority for right now for us, again, is that cash conversion. We're looking into billing. We've had some discussions this past week on some errors that we found in our billing, emanating all the way back to the actual payer. So we're still correcting that. And I'm working closely with Carrie and others, Trissa as well, on trying to figure that out. And of course, Inova. The challenge for us, at least in the short and medium term, is to continuing generating that cash collection engine. The problem is we're not really able to convert that AR into cash as quickly. And so really doubling down on our efforts to figure out how to ignite that engine is the best use of our efforts, at least on the operational finance side, outside of everything we're doing with compliance. So I'll pause there. I know I said a lot of words. Give you guys a chance a second to digest, but if you have any questions, please let me know.
So, are you going to talk any more about cash at this point? Or do you want me to just be kind of a color analyst on this?
Sure. I didn't know how in-depth you want to go, so please, if you'd like to take it.
Yeah, and you jump in.
Sure.
So, Paul mentioned the collection issue. We changed billing companies in, I believe, October. Or no, not changed. We outsourced billing in October. And there's usually a timing period. But one of the things that we are, and I'll talk more about it in my presentation, but we are working with Inova. I had my first meeting with them, and we're going to continue having meetings with Paul, Trissa, and even our managers of what's called key performance indicators. We're establishing with them denials, delayed bills, time from discharge to bill out the door, discharge, not final billed. And we really got to get our hands around it with them. So you have this, got to get cash in, and then you also then have our low volumes. If you don't have patients, you can't bill, right? So you have that going on as well. And so our cash, when you look at what we have in, it's, when you do the calculation and you look at our burn rate per day, as far as, what we're doing in terms of salaries, wages, supply expense, you name it, we vacillate between 6 to 10 days cash on hand at any one time. And what that means is it's a calculation that says if no other income comes in, no other accounts receivable comes in, and there's a hard stop, which usually never happens. You have 7 days cash on hand to keep up with your burn rate. Okay. And so it's serious, but it's not draconian. It's not, it's a situation that a lot of hospitals, particularly critical access hospitals, are dealing with. Ideally, we want to see that number up 60, 90 days cash on hand. And that's our goal. And so, again, when I give my presentation, you will hear what we're doing about it. So tonight's discussion, as normal, as usual, is telling you about the pros and cons and the goods and bads. But I just wanted to be able to draw to your attention that we've got to get that days cash on hand number up. And so Paul mentioned that he and I have a list that he's provided me with all the vendors, the timing, and we are sensitive always to patient care issues, that they be prioritized and paid for, medications and what have you. But we also know that we need to clean up other stuff, some of it back to late 2025, that we want to bring current, pay off, I should say, and talk to the vendors themselves, say we're managing cash flow, we have a rotation basis going on, give us a call before you decide to shut a water off at one of our outpatient facilities. We had that the other day. So we've talked to them, we've staved it off. So it's not panic, it's serious, but we have a plan and it's exciting, and I'm going to tell you about it very shortly.
Just a question about, so basically with this big beautiful bill money, that would be critical in this time for us.
Paul, has the big beautiful bill kicked in just yet? I don't think so.
They have kicked in, but we're still, the state's still under litigation with CMS on how it is best to be applied. The mechanism in which the state's employing is not something that CMS was going to agree with, so they're litigating that point. So for Wyoming, it hasn't, and 11 other states, it hasn't, but for the rest of America, they're drawing on it right now.
Thank you, Paul.
Wish I had better news. I feel like I have nothing but bad news.
Yeah. I'm sorry, and one other thing, Paul, that you did mention, I want to reemphasize. So remember, our days cash on hand is also affected by not billing for January and February for the long-term care piece, because we didn't have the audit in, and they were going to clip our money. So getting that money for January and February is about $260,000 each for each month. So we get that in. I think there's some tax dollars that are being withheld that would help us as well. And then we'll tell about the other initiatives.
That's right.
Back to you, Paul.
Right. So I just had the, let me throw it up on the screen here. All right. So here's our aged AR really quick. And I'm happy to dive into this more once we get better analytics. We're working with Innova right now to get much greater insight into these figures. But on the surface, just to spell it out, HB and PB at the bottom there. Medicare and self-pay obviously are our biggest age buckets. That's been the truth since I've been here. These are the buckets that we're trying to monetize ASAP. And so that's what I believe Pat's going to go into later on. But this is kind of what it's sitting like right now. The ideal situation for us to walk through an analysis would be for us to kind of delineate between what has shifted and what has paid per each bucket over time. Unfortunately, we don't have that level of analytics and data set yet, but we're getting it. So I remain encouraged on that. Any questions before I move on from this one? Okay. So here's the financial highlights. We went over most of this, but I'll just speed run it really quick in case we left anything out. So the FY24 audit, it's winding down. 3/19 we're going to submit. FY24 Medicare cost report, I submitted it on 3/19 to Myers and Stauffer. They're going to perform, I submitted on 3/19. They're going to perform a desk review that's going to kick off with questions next week for me. And then I will have to answer back and forth with them, much like the audit process for the Medicare cost report. All of that should be completed by 4/17 and submitted. The same is true for the FY24 nursing home cost report. We submitted that back on 3/4. However, same process as the Medicare cost report as well. Desk review and then submission on 4/17/26. So they have everything. Everything's in Myers and Stauffer. They agreed that all the parts are there, which is why Amy was generous enough to raise our rates back up, I believe, today. So that's a really good outcome for us, and as we continue to try and maintain compliance. So the FY25 audit, again, hasn't started quite yet with respect to DZA. We have uploaded a bunch of documents already. We'll have to make the adjustments to the FY25 financials based off of the FY24 audit findings. Once we do that and then collect additional information that DZA is requesting for FY25 in terms of support, we will be fully submitted for the FY25 audit with the new information, and that target date for that full submission is 4/16. That's the date. So it's 3 weeks from today. That's how we got there. We had a talk about the right sizing of cost structure for the manor. I believe Kim already talked about reducing that reliance on travel labor. She has, I believe, 8, right, Kim? 8 people in the wings right now on the CNA level, so that's great. We do have to look at the self-pay payment models that are at the clinic as well as the hospital. I believe, again, Pat might touch on that here in a minute. We do have to really examine our AP payment policies and our revolver use. So what we've done recently was on the revolver piece, we had a very large, let me see if I can just pull it up really quick. We had a very large annual expense pop up, and we did use the revolver for that. And the rationalization there was we didn't want to become cash poor in the interim when we can just pay this off for pennies on the dollar. We did do that. It's working quite well right now, and we plan to pay it back in this next 2-month AP cycle. Sorry, couldn't get the words out there. Give me 1 second, I'll tell you exactly what that was for. The UPEL payment. So we had a $104,000 UPL payment. That's what it was, the UPL payment. We had a $104,000 UPL payment. Go out on 2/17. We tap the revolver for that. We'll get $169,000 back, I believe, from the government. Go ahead.
So tell us what a UPL payment is.
So I believe Ken might be better at explaining this. It's a payment emanating from the manor to, I believe, true up the payments that we receive from CMS. But I don't know if Ken has another.
The upper payment limits, like the upper payment. Yeah, the gap payment. So you pay so much, they give you so much back.
Okay, that's a gap payment like we had just, okay, got it. Okay, thank you. I just didn't know what it was.
Perfect. Okay. Right, and so last but not least, there is still this propensity to replace some of our capital equipment financing with some cheaper rates. However, with all the stuff going on with the audit and all of that, we kind of put that on the back burner for now. I think it's something that Pat and I should eventually talk about as a possible strategy, but it's not something we're currently pursuing.
The good news is your capital equipment is in very good shape. So if we don't have this rush to be able to get financing for large pieces of capital equipment. But I understand what Paul is aiming for.
Right. And that's everything on the financial updates for November, unless there are any questions that we want to walk through.
Is there any questions for Paul? Any more? Sorry.
Say that again, I'm sorry.
Oh, I'm sorry. I just asked if there was any more questions for you.
Oh.
Looks like we're good. So I'm going to let Carrie take over now for a little bit.
Sure.
Thanks, Paul. Thank you, Paul. Thanks for your work on this.
No problem.
A lot of the talk in finance committee, did you just tell me to leave?
I think he said I'll be back.
Okay. So a lot of the talk in finance committee has been around compliance and the audits and getting those complete. And we have made significant progress, as I said to you before. I've been doing my best to send you all out updates. I have been functioning in the role that y'all gave to me, which is communication with the team. And part of what I am seeing in my communications with everyone is it's my thoughts that we've never really had a fully functioning CFO here. So we've always had this structure of CEO and COO. When we transitioned that out and brought in the CFO, we've never had one that's really functioned in the role of CFO. So we kind of it's kind of like a new position and new territory for us. So with Pat here and the whole plan with Paul and everything that's going on here, a lot of the plan is going to involve greater communication. And the realization of our whole organization that we don't really function top down, we function more like a wheel. So if you think of Weston County Health Services as the middle of the wheel, every one of your departments is a spoke on the wheel. So with finance being in the middle, each one of you, while you contributed revenue towards the middle, you also have expenses that go out, right? So the paying of the bills, the bringing in of the money, you're all spokes on the wheel instead of a top down, which means that every department is dependent upon every other department. You don't function independently. And that's kind of what I'm seeing in the communication with everyone. We kind of have to get used to more of that spoke in the wheel model versus a top down. So everything each of the departments does is Weston County is dependent on every one of you. So if you think about that, it helps us to come up with a plan where we all work together as one organization, and realize that we're dependent upon each other. And I think that will come a little bit with time, and a little bit with the really good plan that we're developing, and a lot with the increased communication that we've been doing over the past couple months. So I think it's all coming together. We're all learning, we're all growing. I think you all can see significant progress in the whole entire team and how we function as an organization. And those are all positive and good things. And I thank every one of you for your willingness to learn and grow and help Weston County. I mean, the commitment of all of the managers to Weston County Health Services as a whole is really awesome. And it's really good to see. So it will all come together. And I think it's all coming together. It's just taking time.
Any questions for Carrie? Ready. Okay, do we want to right now under finance, since we didn't add that as a agenda item, why don't you just talk about why we need the meeting? I know Pat already sort of did, but this special meeting Tuesday.
I just gave a teaser.
Yeah, so you can just.
So the special meeting on Tuesday that we're going to ask you all for is because today we finally got the report back from DZA on our 2024 audit. So Paul and his team got it last night. They spent the whole night going through it, got back to DZA this morning, and DZA had a meeting with us at 4:00 to do a preliminary presentation on the report that they are going to submit with our audit. The good news is it is complete and ready for you all to take a look at. So that is a significant step. We're halfway there, right? If we were off on everything for 2024 and 2025, we have now gotten everything in for 2024, and that is really significant.
So Paul and team will just clean up some information between now and Tuesday. And we'll focus on one particular issue, but, they plan on having it to us Tuesday in their format and an acceptable, content for then you to listen to them and move it forward and then submit it to the state tax.
Yeah, we were required at the board to sign off on it, and that we will approve it as a board, and that's what we'll do on Tuesday. And then it will be submitted to the state, so.
And so we need to decide, I'm gonna be out of town, but I will be back by 5:30, if we can do it at 5:30. I could possibly make it back as early as 5.
Paul, did we ever come to a conclusion with DZA about are we able to do it at night or?
I think he was gonna send the, gentleman who was on there, you normally meet 5:30, correct?
That's on.
And, he could do it, but Sean couldn't.